I'm Stafford Smith with the Office of Public Affairs with the Centers for Disease Control. This is the 40th anniversary of the founding of the Office of Malaria Control in War Areas, a World War II organization which was established in Atlanta to help eradicate malaria in the southeast. This is also October 26, 1982. It's the third annual Joseph Mountain Lecture given at CDC. With us today is Dr. Samuel Simmons, who was very much active in the MCWA operation. He was in charge of the Technical Development Laboratories in Savannah and later in charge of the Technology branch at CDC. Dr. Simmons is going to give us some reminiscences about his work in malaria.
I suppose the best thing would be to, since I was on the early days of MCWA, would be to start back at my first knowledge of it and reminisce up through the years that I was associated with the MCWA and the CDC. I was down in Panama City the first time I knew anything about MCWA, and incidentally it was not MCWA at first. Instead of malaria control in war areas, before we actually got into the conflict, it was called malaria control in defense areas. Then after we got involved, it was called malaria control in war areas. Well, I was down in Florida with another agency, but the MCWA had an interest in the work that we were doing. So it must have been about 1942 that I was appointed a consultant to MCWA, and Dr. Louis Williams was in charge here in Atlanta of the MCWA. And so they furnished some people to the program and some money, but I was with the other agency, but I was in charge of both programs. And as a couple of years went on, and so I had discussed back and forth with the people here in Atlanta and MCWA about coming with them. So finally, at the beginning of 1944, Mark Hollis was in charge then, and so I took a commission as a full grade officer and went on duty with the MCWA. Now, about that time, this insecticide, DDT, had come into the picture, and we didn't know anything much about it, except that it was a very powerful insecticide. And we needed some information on how to use this material, what dosages and formulations and whatnot. So it was decided to establish a station, a laboratory, if you will, to answer some of these questions. Now, MCWA was supposed to be strictly an operational program and was not supposed to be doing any research work. So we went to Savannah, and I had to get a staff and some equipment, and we were in what was known then as the old Carter Memorial Laboratory, which was named from Henry Rose Carter and belonged to the city of Savannah. And it was a nice, small laboratory. And we started work there, and naturally what we were doing was research work, but we didn't call it that because it was against policy for MCWA to carry on research work. But we called it Operational Development Program. And we soon, in about, I guess, about 2 or 3 years, we filled up this little laboratory, and we got a chance to get the VD hospital out on Oakland Island, which was a rather large building. So we moved out there in '47. And by that time, CDC had been formed, I believe in '46. And Dr. Joseph Mountain was Assistant Chief of the Division of State Services, under which we came. And later on, he was chief of that, and he used to come down to Savannah, and he visited our laboratory and in our home. He and Dr. Charlie Williams both. And we had built up quite an operation down there, I guess some 150 people we had. And eventually we branched out and got into all other types of work. I think the second program that we took up was the Endemic Typhus program. We brought in some medical officers and started to work on the transmission of endemic typhus. And later on, we took over or established work in schistosomiasis down in Puerto Rico. Had a laboratory on dysentery and diarrhea and down on the Texas border in Far, Texas, and got into the hospital infection problem. This was when the staphylococcal infections were so common in hospitals. And then in '53, the work that we were doing at Savannah and the branch laboratories was combined with a couple of other organizations here in Atlanta, and I came up to head those up. And one of the big tasks was to shake the organization down, so to speak, to peacetime conditions. There were still some over 2,000 vehicles out assigned to the states, and 500 or 600, 700 people. So the first couple of years I was up here, I was reducing mainly, getting on a peacetime basis. It was not, it was a very intriguing program, but not very pleasant one. It's nice to build up an organization, but not too pleasant to tear it down. Well, we reduced it down to about half that size, I guess. And we took over the work in the arthropod-borne encephalitis out in Logan, Utah, and transferred that up to Greeley and later to Fort Collins, Colorado. And we had a laboratory on dysentery and diarrhea down in Phoenix. We were stationed in the Indian hospital there. But we built a new, nice, large laboratory in Phoenix and branched out and got into hepatitis work. We eventually built a new building up in Fort Collins and got into streptococcal diseases up there as well as the encephalitis. So we were had a broad spectrum of research work going on. And we also got into state services work, wherein we would assign a person or two out to a local health department to assist them in creating a model health program. They would assign people to our man, and we kept them formulate a model health program that would last 2 years, and then by that time they were in a position to take over. And we did this in many places throughout the United States. I don't know how many programs we had going. But that way we were applying in an operational form, you might say, the research results that we were getting in our various laboratories. We also started some training work, particularly in hospital infections, training people how to recognize them. And up until about 1966, when I went on another program, we were doing a broad spectrum of programs, essentially about everything that the center was doing. I think it would be interesting, which I should have done previously, to say a few words about the work during the war period and how it was different from what you encounter today.
You had earlier mentioned some international activities out of the Savannah operation.
We got into international activities in a big way before the Atlanta office did, and the reason for that was that the World Health Organization, one of their important programs was malaria control throughout the entire world. So they created some expert committees in Geneva, and they had an expert committee on insecticides, and that was when DDT and some of the new chlorinated hydrocarbons were just coming to the picture. So they formed this expert committee, and the first year, I believe, was 49 or 50. And there was only 3 people on the committee, and one was from France, one from England, and one from the United States. Dr. Bob Galley was a member from England, I was a member from the United States, and I forgot the gentleman's name from France. At any rate, we had those committee meetings about once a year at Geneva, and we invited them over to Savannah, and we had 1 or 2 of the meetings over there. And so then they formulated a panel. Instead of having just 3 people, they had a panel, maybe a dozen people, and they would pick a number of people from this panel each time there was an expert committee meeting. And the panel, the WHO got interested in broader aspects of malaria control, including the toxicity of these compounds to people. So we had gotten in by that time to a toxicology program, the medical aspects of these chemicals. And so Dr. Waylon J. Hayes was in charge of our work on that. And if they were going to discuss toxicology, well, he'd be invited. If we were going to discuss engineering aspects of it, well, maybe Larry Hall would be. Anyway, I was able to get a lot of our people on the phone. And that was the reason that we had a lot of international travel. Then at one of the expert committee meetings, I was asked to prepare a program of research for the WHO, and you might say the resistance of insect vectors to the chemicals which they had begun to develop. So I recommended that the WHO contact all of the research laboratories, the main ones throughout the whole world, and get their cooperation in submitting their research to the WHO, and so that they would know what was going on. And that was written up, and the Director General of WHO accepted that. Now,
what year would this have been? That was after it became CDC, wasn't it?
Yes.
Since I believe the World Health Organization was established after the war.
Yeah, that's right. So this was after it became CDC, and I don't remember. It was in the 50s sometime. The first expert committee meeting was, I believe, in 50. It was either 49 or 50. Mm-hmm. So the World Health Organization called on our laboratory at Savannah to help them appraise research work and find out what research work is going on throughout the world. So since I had suggested this, felt kindly obligated, so we would loan WHO some to visit the laboratories in certain parts of the globe and make contact with them and explain it to them and get their cooperation. Well, as it turned out, the World Health Organization could give a small grant to some of these laboratories, and that induced them to send their material in to the World Health Organization. And that way the World Health Organization, and they depended a lot at that time on the Savannah group because they didn't have the technical staff in Geneva. We would loan the Geneva office. Larry Hall was over there, and Dick Fay was over there, and Jim Miles was over there, and we would loan them people to help them develop the program. Maybe they'd stay 6 months, maybe a year. So I think one of our great contributions was to help the World Health Organization get their program going on malaria and malaria research throughout the world. So we had people traveling to every place in the globe practically except China and Russia. But practically every place else, we had people that we had sent out there to see what work was being carried on. So we were doing a great deal of international work with the World Health Organization really prior to the time that the Atlanta office got into their extensive global activities.
What time did you move out to Oatland Island from the road?
That was, we got out there about 1st of July in 1947.
Now that Oatland Island building, what was that used for before you took it over?
Originally, that building was built by the Brotherhood of Railway Conductors as a retirement home. Beautiful place, large place. And then the war came on, and the Public Health Service took it over. Actually, they didn't have the authority to take it over, so they got what was called the Works Progress Administration, which had the authority to take it over and let the PHS use it. And it was used as a rapid treatment center, a VD hospital. And Dr. Diebert was the first man in charge, and then Dr. Larry Smith, who was chief of CDC, and following him was Bill Brown, Dr. William J. Brown. Well, it wasn't very difficult to take the place over because the Railroad Retirement Act had passed, as I understand it, in the meantime, so most of the people had gotten some retirement and was leaving. So they took that over, about 100 acres of land, the main building, the nurse's home, and the magnificent set of quarters. A separate house down about a quarter or half mile from the laboratory for the director. Well, we had to renovate the place completely to make laboratories out of it. It had been a VD hospital. It was overcrowded and it had triple deck bunks, and so we had bring a lot of high-powered wires for electricity in there to run our equipment. And we built probably about 15 additional buildings. And it was developed into a first-rate, well-equipped laboratory for a broad spectrum of communicable disease research. And it stayed that way up until, I forgot, when was it? It was disbanded and brought up here. I hated to see that. I think that it was a mistake from the standpoint of the facility, because I don't think the Public Health Service could probably ever get another facility like that where you could have 100 acres isolated and do whatever you wanted to, so to speak.
I remember one particular project you were working on before the manned space flights. You were involved in some of the preliminary work on back contamination.
Well, Yeah, we got into trying to find out how we could place people, you say, on the moon or other planets and not have them contaminated, and also how they could come back without bringing any contamination back. Of course, at that time they were contemplating the moonshot, and although no one suspected particularly that there might be any life there, they didn't know but what maybe there might be some low form of bacterial fungi. So we built some chambers and would use various types of protection for the individual and put them in the sterile chambers and to see if they would shed bacteria through these garments.
Was one of them called a microbiotank?
Microbiotank, we developed that. And so Larry Hall was in charge of that particular work, and we had a staff of engineers and bacteriologists on that. And then we got interested in detecting contaminants in the air. And this was the days when they were talking about the possibility of eventual bacteriological warfare and how we could detect contamination. So this work with the National Aeronautics and Space Administration kind of led into. We had a number of airplanes down there, and we developed bacterial or particulate collecting instruments to carry up in those planes at different levels to see what we could detect. And so we had to develop first instruments because there were not good instruments for collecting bacteria. And that led in, about that time, the staphylococcal program in hospitals attracted attention. They were having a lot of contamination of surgical cases. And so we got into the hospital infection work. We would go into hospitals and try to see what was peculiar to those hospitals that had had a high incidence of post-surgical infections. And we found a lot of physical things that were wrong. Oftentimes the air intake would be right close to the exhaust from the laundry and that kind of thing. We also found that there were nurse and surgical carriers that had nasal infections that would get a higher incidence of post-surgical operation where those people were involved. So we set up a training program to help train some of the people in detection and control of hospital infections, and I suppose it's probably still going on here. It was moved to Atlanta. We moved it up here about the time that Larry Hall, who I stated was in charge of the work at Savannah, but during his work he had gotten to working so close with the National Aeronautics and Space Administration that he finally went with them and headed up their program in planetary quarantine and stayed there until he retired. Today, when we were at lunch, the group of MCWA people that are still around here, I mentioned the difference in operations back in the war years and now. We couldn't get equipment back in those days very well. It was just a shortage of everything. You have a high priority in order to get anything. But if you found it, you didn't have much trouble getting it. Money was not any particular problem, and red tape practically didn't exist. We could buy things on emergency. We'd just fill out that this was an emergency, and it would be accepted, and that was all there was to it. As I mentioned in there, I had to buy some pontoons for an airplane, and found that an individual had some for the particular plane that we had up in Long Island, and I just called him and told him to ship them to us. We'd ship him a purchase order, and I didn't know whether he'd do it or not, but he did, and that was all there was to it.
Was that for the type of pontoon planes used in malaria control?
It was survey, yeah. We were not actually using them for control, but it was for survey work. And and for other vectors of insect vectors of disease. But as I stated, most of the people were in the Army, and of course there was a shortage of personnel, so that we just didn't have the office staff and administrative work that you have today.
The people that you're talking about that were in the Army, are they the trained people that you might have needed?
No, I'm speaking of the fact that most of the young men were in the Army, and a lot of the girls and women were working in defense industries, so that administrative and office today, like purchase and supply and that kind of thing here in CDC and throughout the government, they're well staffed with a lot of people, you see. Mm-hmm. So you can have a lot of rules and regulations, you know, that go through all of this group of people. But then there wasn't any people to staff those offices, so we just bought on emergency, and we didn't have any red tape to go through with. If you needed something that was over and beyond what you felt comfortable in purchasing out in the field, why, usually all you had to do was to pick up the telephone and say, well, I've got to have another automobile, or I've got to have a lot of equipment and so forth, and well, okay, fix out an emergency purchase on it, or something of that sort. But when it was over, these administrative offices filled up again with red tape artists, and then things began to slow down, you know. And they've been slowing down ever since. At least that's been my experience up until the time I retired. That naturally, the more people you get to do a job, the longer it takes to do it, particularly if it is a paper job.
Like Parkinson's Law?
Yeah. Mm-hmm.
The work expands to meet the number of people.
The work expands to meet the number of people, and that is absolutely true. But it was very efficient work back during the war, as I say, because of the lack of red tape. It was difficult because of the lack of ability to get equipment. But the dedication of the people back then was something to be proud of. They worked to get the job done without any thought of hours or anything else. Everybody was trying to get the job done, and I think we accomplished more per man hour, you might say, than twice as much as you do today. And that was due to lack of red tape, and I guess due to the war, the dedication that the people had.
I think there was a spirit of cooperation.
Yeah. Mm-hmm. But they worked hard, and as I say, nobody paid any attention to hours. If the job needed doing, they did it.
Well, getting back to MCWA, do you have any other recollections of your work in Savannah or your connections with the Atlanta office or the early officers that were in charge, working with some of them?
When I went with MCWA, Mark Hollis was here in charge in Atlanta, and Harry Hansen was the deputy, and I was up here off and on as a consultant working with them, and as I say, I finally came with them, and Mark Hollis was a wonderful person to work with. He was keen, and he was cooperative, and he gave you excellent support. And Dr. Charlie Williams was chief of the bureau in Washington, and he was easy to work with. Dr. Joe Mountain was easy to work with. And let me tell you the difference we had from what you have today. You had contact with these people. For instance, when I was at Savannah, before I moved up here, I was just in charge of the laboratories down there. But I had complete contact with Dr. Charlie Williams and Louis Williams and the Surgeon General, or I even went up on the Hill and talked to some of the congressmen, and they knew it, and so that I could make decisions, not only me, but other people in parallel positions, at that time that a committee would work a month on in Washington today to make that decision. I would make it right there. And I knew I'd be backed up because I knew the people in Washington. But it's gotten so large that you don't know those people in Washington intimately, the various chiefs of bureaus and whatnot in Washington. Like I knew Dr. Charlie Williams, who was the chief of the bureau. I knew visited with all of them, even the Surgeon General. And all of them have visited in our home. So it was easy working where you knew all of the people right up to the top.
Would these decisions be related to supplies or directions for your operation to take?
Well, pretty much to programs too. If, for instance, I decided that we want to get into toxicology, Dr. Joe Mountain supported that 100%. In other words, as soon as it was mentioned, why he began to push it. Well, he was in a position where that meant that we were going to have it. And all of the other programs, now you remember we started out in the technical development laboratories with just malaria control. We had a little Aedes aegypti work. And we started next the endemic typhus research, and then all of the other programs that we took on, the myriads of different programs which had nothing to do with vector-borne diseases, we instigated down there. So you just kind of eased into them a little bit and got a good story, and if they believed in you, you got support. And the reason is you got it because you could talk with the top people. And the people at that time in the center, as far as I'm concerned, they didn't care for me. Whatever I could get out of Washington was just that much to the good, because I think we knew one another well enough, you know, that they knew that I wasn't going to do anything out of line. I was going to keep them informed. But decision making was more of an individualistic thing than a group thing, as it is today. But I found out, well, in 1966, I guess it was, they had developed Dr. Bob Anderson, who was the chief of CDC here, had gone to Washington as chief of the Bureau of State Services, as after Dr. Joe Mountain died. And maybe there was a intervening chief in there.
was
Dr.
chief
Burney, I believe.
in the mid-50s, I believe.
Yeah, and Lee Burney was
Surgeon
chief
General.
a while before he was Surgeon General. He was assistant chief, I guess, to Dr. Joe Mount. I don't remember the exact.
Dr. Burney was not a chief of CDC.
I'm talking about a Bureau of State Services.
Services.
Yeah, before he got to be Surgeon General. So we were small enough that you know, you knew all of those people personally. And speaking of Dr. Burney, I recall a very amusing and embarrassing incident. We had what was known as the U.S.-Mexican Border Health Association. Each year, while we'd meet with the Mexican health authorities, we'd meet on this side of the border one year and on the other side of the border the next year. So Bob Anderson, Dr. Anderson, who was the chief of CDC, I was going out to the laboratory, our laboratory in Phoenix, and Dr. Mel Goodwin was director of the laboratory at that time, and I was going out to visit the laboratory at the time of this meeting and timed it so that I could attend the meeting. So I asked Dr. Bob Anderson, talked him into going, so we went out there. And we drove from Phoenix down to Sonora to this meeting. And it was in the spring, but it was real hot down there. They didn't have any air conditioning, and this was held in an auditorium out at the University of Sonora, I believe. And so Dr. Lee Burney was Surgeon General, and he represented the United States, and the Surgeon General, or I guess the Secretary of Health for Mexico, represented Mexico. But there was a man in Mexico, let's see, that's Dr. Bustamante, I believe, if I don't have my names crossed. He was well known internationally in malaria work. So he was to give the main address on malaria down there. Mm-hmm. And of course we had headphones with translation from Spanish to English. And I was sitting back in the auditorium there, and I had those headphones on, but it was kind of warm in there, and he was talking in Spanish, and this thing wasn't coming over too good. And I just kind of dozed off and asleep, but I didn't have any idea what he was saying. And so after a while, I heard somebody calling my name, and so that kind of startled me, and I sat up, and Dr. Burney said, Dr. Simmons, would you please come up and comment on Dr. Bustamante's speech? And I didn't have any idea what he had said. Well, I went up there, and I still don't have any idea what I said. I don't have the slightest idea. But that was rather an embarrassing situation.
Well, that must have been, since you didn't know Spanish.
Yeah, it sure was.
Well, Dr. Simmons, I think we've covered a good bit of territory, and we will review this and maybe get you back. We might have some further questions after we've interviewed some of the others. You
could talk on this forever, I guess. I don't know whether I've covered the most important aspects of MCWA and CDC as I know them or not. But
well, you brought us some good material, and also we're working on a history of MCWA, and I expect for you to review that and maybe add some more material to it. Aren't you working on a history of the Sencer also? Well, of course, that would be. That's being done. I haven't been working on that myself. Is Jim Payne working on that? He was. I'm not sure right now what he's doing. Mm-hmm. Well, I've enjoyed the reminiscence, and I'll be looking forward to seeing what you produce. All right. It's been a great day. Well, thank you. Thank you.